Okay, so step two in getting pain-free from your sciatica is solve the underlying risk factors. What do I mean by this? Many of these cases will say, I had sciatica, I did this treatment, and then it actually went away, but then it came back. Or they went on this pain med and it felt great for like a week, but then the pain came back. Or they kept getting this manipulation done. It felt good for a day, but then the pain came back. If you're dealing with pain that keeps on coming back, you're missing the root cause and you're missing those underlying risk factors. So some common risk factors that we see here at Pursuit are a lack of full hip flexibility. So yes, the hip can influence the low back and surrounding areas, causing an increase in compression, a lack of range of motion, or pinching around the area, causing sciatica. We also see some muscle trigger points that are also missed. I mentioned in the prior video about the QL or the piriformis. If you identify those tight muscles or painful muscles that have trigger points, you can identify those, solve those, and kind of solve that underlying risk factor. Another one is hip rotation. That's another common one we also see. And then the concept of neural tension, where you have damage to a disc or the sciatic nerve and the nerve gets tight and you never regain the tightness because the back heals in 4 to 6 weeks, or you went on some anti-inflammatories or meds and it healed, but you're left with this neural tension. That's an underlying risk factor. And again, the key to solving this is because you don't want to deal with a recurring experience of having sciatica. Oh, it feels better and then it comes back every time I go drive. Oh, every time I bend forward, I start to get sciatica. Or every time I lay down in bed, I start to get sciatica. So if you're dealing with a recurring case of sciatica, you're probably missing the root cause and these underlying impairments. And that's why it's essential to get a customized treatment approach where, based off of your findings and your root cause and your underlying risk factors, you customize treatment to identify each one of those, and then you get the results and the good outcome as you want. So if you're still interested and you want to click on step 3, just click on the button below, and then we're going to start talking about treatment.